Hi, it's Dr. Brian McDonough, and welcome to the Dr. Brian McDonough Show. Today, I have a very special program. My guest is Dr. Darylyn Moyer. Dr. Moyer is the Executive Vice President and Chief Executive Officer of the American College of Physicians. You're going to notice that organizations like the College of Obstetrics and Gynecology, the American Academy of Family Physicians, surgeons, the College of Physicians are starting to do more and more to speak out and try to get you as consumers, as patients, as people of our country, the best and most effective information. So my interview is with Dr. Moyer to discuss some of the key issues we're facing right now. Dr. Darylyn Moyer joined me last week. It's no accident that we're talking now, although I'd love to talk to you, and we have over different points in our careers. But right now it's really important because you do represent a significant number of physicians and have a very important voice. I want to talk about what's happening in healthcare right now, but go back a little bit because I think at the root of what maybe people have questions with or where there's concerns was COVID-19 and the pandemic. Tell me a little bit about your perception of that time and what we may have done right or wrong and how we can kind of get past that.
Well, how much time do we have? I think we only have about 15 minutes, but I think there are lots of lessons learned. I mean, we've certainly seen because of so many things happening in our world, with the change in climate, with having so much contact with animals, spillover pathogens, etc. It was only a matter of not if, but when we were going to see a pandemic emerge. Of course, a unique coronavirus emerged in late 2019 in China. We saw, of course, because of air travel and globalization in the world, rapid spread around the world, that air travel is faster than the incubation of many viruses these days. And of course, Operation Warp Speed and the amazing mRNA platform, which has been around for decades, enabled us to be able to face it down and deliver a vaccine in a record amount of time in less than a year that was responsible for saving, I believe the projection was, somewhere in the area of hundreds of millions of lives worldwide. And I think it's very important that we look back to learn as we move forward and we experience the next pandemic. And once again, it's not if, but when, how we can do better. And one of the important lessons that we learned is how we talk about science, the scientific process, and scientific policy, because they are not all the same. And we could have done better when we talked about science. We talked about vaccines slash immunizations, and we talked about immunity with the public. We really needed to do better talking about science as an iterative process. Science evolves. What we know today is not necessarily going to be the same thing that we know tomorrow. A famous medical school dean once said to a graduating class, students, new doctors, 50% of what we taught you during medical school will soon be false, and it will be disproven. And the problem is we don't know which 50%. So science is going to evolve. We need to make that very clear cut. We also needed to do a better job at talking to people about immunity. Vaccines are very different with the type of immunity that they confer. Childhood vaccines, such as the measles, the mumps, the rubella, the varicella vaccines, are very good at giving lifelong immunity to patient populations. But when we were confronted with a rapidly mutating virus, such as the COVID-19 virus, we knew that it was going to mutate very, very rapidly. And that initial immunity that we got from those primary vaccines that we got in 2021 that prevented those waves of those infections at that time were not going to stick. But the important thing that we really needed to convey to people was, even though for subsequent infections, those updated vaccines would not necessarily protect you from getting a subsequent infection because of that rapid mutation and evolution of the virus. What it was going to do was going to protect you from getting seriously ill, getting hospitalized, and dying from the virus, and particularly true for immunocompromised individuals, pregnant individuals, and people that are aged, such as folks that are 65 and over. So we really learned our lessons in terms of how we need to enter the science into scientific policy. The other thing that we learned is how we talk about how we have to adjust what we're doing. We really needed to be better about talking about overwhelm of healthcare capacity, right? Because how we talked about it was the overwhelm of the hospital systems, emergency rooms, hospital beds, ICU beds, ventilators across the United States. We should have done a much better job at tracking those statistics and being able to very quickly being able to pivot. We had lockdowns, and this is, again, another myth that has been perpetuated. Lockdowns happened in about 80% of the states for 4 months or less, and essential workers, who were 80% of the people, were not locked down. And what should have happened was that we should have been much better at taking a look at healthcare capacity in real time and being able to adjust what we did with the public in terms of what was happening, in terms of school closures, in terms of other types of closures, and been much more facile with that data, had much better systems that were much more interconnected in terms of healthcare capacity. And now we're in even a worse scenario because we've seen lots of hospital closures, actually, particularly in rural areas since the pandemic happened. And we have less healthcare capacity now in 2025 than we had pre-pandemic.
There's so much to unpack with what you said, and we do have limited time, like you said, but a couple points to reiterate. I agree. I wrote a book back in 1992, 1993, and I wouldn't show that to anyone now because so much of what I said, and I had experts helping me, has changed. And that shows how medicine changes. And I do agree that in the early stages of the pandemic, maybe because it was politicians spreading the message, maybe not, maybe we did a poor job, but a lot of the messages were this is absolute. This is the way it works. And then social media picked it up, and no one really explained that science is about asking questions. So when we look at the present situation, we recently had the Surgeon General of the state of Florida say that vaccines should not be mandated as a more or less that you should not be told what to do. Is the genie out of the bottle, or what can we do to try and correct or change things?
Really challenging times. I mean, everything I should have learned in life, I learned in kindergarten, right? I can't teach you how to care about others in your community. It's interesting because the issues about concerns and people that may not spread accurate information about vaccines is not new, right? In the late 1700s, when Edward Jenner had started inoculating people against smallpox with the cowpox virus, stuff was going around that you're going to mutate into a cow if you're going to accept this vaccine. And in 1905, when the Supreme Court mandated smallpox vaccine for everyone in the United States, they said individual liberties only extend as far as you are not trotting on the liberties of others in your community. We need to figure out how to convey that it could be the person that you love whose individual liberties are being stepped on. And we need to solve this with hearts and minds and make it personal. And we need to understand that we have to, I love this saying, jab my arm, not my morality. Some people believe we shouldn't even be using terms like misinformation, that is immediately othering people, and that we need to really be much better, be less paternalistic, to not just talk to people with facts, but to really listen. Because let's face it, people have had different encounters with healthcare. They have had their own lived experience with healthcare. We need to understand where they're coming from. And there's lots of polarization in our society in many areas these days. But there's lots of folks that are in that movable middle that I believe we can have a conversation with. And I find that is what's really effective, whether I'm talking about immunizations, whether I'm talking about cancer screening. And I do deal with a highly skeptical patient population working in North Philadelphia, where lots of those folks have not had good lived experiences with healthcare over the course of their lives and their families' lives. That when I make it personal, when I talk about what has happened to me and what I have done for myself and for members of my own family and for my friends and neighbors, that really makes a difference when you can make it personal. And you may not get to yes on the first conversation, but building that trust, building that relationship is really important. There's a lot of data that demonstrates that despite all of the social media that's out there, that all of this quote, like lack of trust that's apparently swirling around, that folks that have a longitudinal established relationship with a healthcare practitioner that they trust, they listen to them. And I think that's where the fragmentation in our healthcare system, because of many aspects of the medical industrial complex that are out there, has really not served us well. We need to be able to ensure that everyone has access to a longitudinal primary care practitioner, because we know that at least 1 in 3 people out there do not have that. And I know that you know, because you practice in this world as well. Try finding a primary care practitioner. I can't even find people for friends and neighbors and people that could contact me from around the country. It's a struggle. And we've got a big network with internal medicine because we're 25 of the practicing docs out there. So it's going to take all of us, and it's going to take time. And we're going to have to do it with hearts and minds, one person at a time.
I want to be respectful of your time, but I want to ask you a big picture question. So the American College of Physicians, like you said, it's a huge organization with a great reach of physician leaders around the country. What can you do, big picture, to try to maybe sway or in any way influence the changes that are occurring when we're looking at, when we're looking at vaccines, when we're looking at the USPSTF, any number of things that are being discredited that kind of guide all of us as physicians? What can you do to try to maybe bring people back to a sense of common sense?
Well, we enhance the quality and effectiveness of healthcare by fostering excellence and professionalism in the practice of medicine, and that is done by practicing evidence-based medicine. ACP is working in conjunction with our friends in family medicine, pediatrics, OBGYN, Infectious Diseases Society of America. And because of the changes that have happened at the CDC Advisory Committee on Immunization Practices, ACP has its own clinical policy initiatives, and through our Population and Health and Medical Sciences Committee, and through the fact that we are the only physician organization actually in the world which has both a GRADE and agree designation, which recognizes the excellence with which we do evidence-based guidelines and recommendations. We have undertaken the recommendations for seasonal respiratory infections, influenza, COVID-19, RSV, through our Population Health and Medical Sciences Committee for the 25-26 season.
Dr. Darylyn Moyer, thank you, first of all, for all the work you're doing, all the work you've done in your career, and for sharing your time at this really important time with us. I really appreciate it.
Thank you, Dr. McDonough.